Ma'am,
Yes.
this question maybe I did give the examination examination the last 1 or 2 days back.
Yes. Could be similar. Yes.
Yeah, yeah,
Okay. So if you have read and understood, considering it
yeah.
an optimization, please tell me if you could identify on picture C, what kind of joint is this?
It's a shoulder joint.
Please tell me how shoulder joint is formed or shoulder
Yes,
girdle is formed.
yes. It is formed by the glenoid cavity of the scapula and the head of the humerus.
Okay. What are the structures which strengthen the shoulder joint?
Okay, the rotator cuff muscle, the joint capsule, glenoid labrum, and the glenohumeral ligament.
Okay, what are the bones which are involved in the formation of shoulder joint?
Sorry, ma'am.
Bones which are involved in the formation of shoulder joint?
Humerus, scapula.
Okay. Right, head of the humerus and scapula. Okay,
Yeah, head of.
right. Please tell me, what do you understand by the term rotator cuff?
Yes, it's includes the four muscle, the supraspinatus, infraspinatus, subscapularis, and teres minor.
Okay. Can you look at picture A and identify, okay, if you could identify number 2.
Who is the acromion process?
Okay, if you could, acromion process, all right. If you could identify 15, please.
Supraspinous process.
5,
Infraspinous process.
11,
Fossa. Sorry,
fossa, yes.
fossa. Yeah.
11,
Subscapular fossa.
right. If you can move down and identify, uh, right here. In this one, if we can identify 7,
It's very small to locate.
yes.
Is
Okay, I'll
7.
tell you, it's the
Coracoid process. Coracoid process.
margin of glenoid cavity, it says.
Yeah, margin. Yes.
Okay, please, I would want you to tell me. Right, you told me what are the, okay, can you identify coracoid process in picture A or picture B?
Yes. In B, in 9. No, madam.
Is it 9 or
Three,
3?
three,
3,
three, three,
yes,
three, three.
3. Now, please
In
tell me,
14, in A, it's 14.
okay, please tell me, number 3, all right, coracoid process. Please tell me what are the structures which are attached to coracoid process, both ligaments
Yes,
and
ma'am.
muscles.
Yes. In muscle origin, the short head of the biceps brachii, coracobrachialis, and insertion of the pectoralis minor muscle. The ligament includes the coracoacromial ligament, coracohumeral ligament, and coracoclavicular ligament. It includes the trapezoid ligament and conoid ligament.
Very good. Okay. Right. If you would you be able to identify in this picture C,
Yeah.
if you could identify bicipital groove, where exactly is the location of it?
Yes. In between the media, greater and lesser tubercle
Okay.
in upper part.
Please tell me what are the muscles which are inserted there?
Yes. In the lateral lip, the pectoralis major; in the medial lip, the teres major; in the floor, the latissimus dorsi; and content is the biceps tendon.
Okay. What decreases the stability of the shoulder joint?
Okay, ma'am. The shallow glenoid cavity,
Yes.
lax capsule,
Yes.
less ligament, and
Yes.
there is the defect in the inferior aspect due to the quadrangular space.
Please, now that you have started this, I want you to identify. Yes, you have already mentioned quadrangular space, so
Yeah.
QoS. Please tell me the boundaries of the quadrangular
Yes, ma'am.
space.
In above the teres minor, superiorly teres minor, inferiorly
Yes.
the teres major,
Yes.
medially the long head of the triceps, and uh, medially long head of the triceps, and laterally the humerus, body of the humerus.
Right. Please tell me the contents of the quadrangular space.
Yes, ma'am. Axillary nerve and posterior circumflex humeral artery,
Humeral vessels, both artery and vein.
humeral vessel.
Right. Okay. Now you're looking at the image. I know it's very small. There are two triangular spaces as
Yes,
well. Okay. If you can identify T1 and TS.
yes. TS the superior triangular space, and T1 is inferior triangular space.
Please tell me the boundaries of both of these.
It's TS is the upper
Yes. Please tell me
space.
the boundaries.
It's above by the teres minor, below the teres major, and laterally by the long head of the triceps.
Okay. And what are the contents of TS?
Yes, it's the circumflex scapular artery.
Very good. Now please tell me the attachment of T1
Yes, T1 is above by
or
the teres
TI,
major.
triangular interval. Yes.
Yeah,
Above is?
teres major,
Yes.
and then হচ্ছে long head of the triceps medially.
Okay. Long head of the triceps, right? What
Triceps,
are the
yes.
contents of this triangular interval?
It's forgot, ma'am.
Radial nerve and profunda brachii
Yes,
artery.
profunda brachii artery. Yes, yes.
Yes, now you know it. Good. Please tell me what is this that you're looking at?
It's the MRI of the shoulder joint, oblique view.
In which conditions would you ask for this image?
If I suspect the rotator cuff tear
Okay.
or
Uh,
injury,
yes. Can you please identify the structures which are labeled?
yes,
Okay, one, please.
is the acromion process.
Four, please.
Four is the clavicle,
Okay, five, please.
deltoid muscle.
Six.
Six, glenoid cavity.
Seven.
Glenoid cavity, and seven
Yes.
is the labrum, glenoid labrum.
Seven is labrum. Six was correct.
Labrum. Six is
Okay.
glenoid, yes.
Yes, 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 yes. Right, you have told me. Now I want you to tell me the course of the axillary nerve. Or yes, the territory of supply of the axillary nerve.
Axillary nerve. Yes, ma'am. Is the continuation of the arise from the posterior cord of the brachial
Very good.
plexus,
Yes.
uh,
And root
and
value?
root value C5, 6, 7, 8, and T1,
I think
or
C5 only.
C5, 6,
Yes.
7
And then
is radial nerve. C5,
auxiliary, I think
6,
it's only
7,
C5. Yes. Okay,
5,
please tell
6.
me more. The motor and the sensory supply of auxiliary. So it supplies motor supply to which muscles
Yes, yes, ma'am. Deltoid and the teres minor.
and sensory supply?
Essentially, the lower half of the deltoid, the regimental base area.
Yes, regimental badge area. Yes, very good. Right. Okay. Now axillary artery has three parts. What are their names
Yes.
and what are their
So
branches? Very quickly.
yes, first part from the first part superior thoracic, from second part lateral thoracic, thoracoacromial, and and from the anterior posterior circumflex humeral.
Very good. Okay. Subscapular, anterior circumflex humeral, and posterior circumflex humeral.
Yeah,
Very good. Okay.
ma'am.
Very good. Very good. Very good. Very good. Okay. Well done. I think this is my last one. Yes. Thank you.